about the communities of excellence through our Baldrige journeys. So the County of San Diego Health and Human Services Agency has been on the Baldrige journey for some time. And so back in about 2015, Rick Norling, the co-founder of Communities of Excellence, and Stephanie Norling, the managing director, they came to us, to the county, to Health and Human Services, to share the framework, the program, and their vision really for improving the performance of communities in our county. And so they had heard about the work that we're doing in the County of San Diego related to Live Well San Diego. And I think they were just impressed with it. And they really gave us an opportunity to review the framework and provide them with feedback as it relates to Communities of Excellence. So we eagerly partnered with Communities of Excellence and just really began planning with our leadership in particular, how could we apply this specifically in one region? So the county has 6 regions. This was one region of the county. In the last decade, there's been significant change in our dietary habits, right? Physical activity levels, tobacco use in our population. And so we knew and we know, and we had a community that was engaged on how do we influence these, these 3 unhealthy behaviors that we're seeing in the county. And so we really, an important part was how together as a leadership team, using Communities of Excellence and all that we were learning, how do we ensure that we really continue the work that was already happening, develop new innovative approaches. How do we help educate and, more importantly, empower our residents to really make healthy choices for themselves and their families? So I think that was the challenge that we were working on and that we had entering this journey. We saw the potential, but once we actually started getting involved, it was extremely impactful and probably in a way that my leadership team and I didn't realize. But it really helped us to carry the work that we were already doing in the community and carry it further. So it helped bring that diligence, the really depthness, the thoroughness that only Baldrige can do to our community. As an organization, we were already on the Baldrige journey, but of course it didn't have that community component. So we had always approached the community work through a systems perspective. So we quickly understood that it was important to have this Baldrige-based framework that could help us better assess our performance in the community, identify gaps, help to create the new processes, document those processes, and then the approaches to really make our work more impactful. The approach really helped us understand that this is a team effort, it's a journey. And then it helped us develop that strategic planning process and then to deploy it in 2017. We are a binational community. And what does that mean, right? We know people live, work, and play across both sides of the international border. But how does that apply to our residents? How does that apply to us? So we have an extensive list of partners. But it includes our school districts, it includes local government, it includes the cities, it includes our community-based organizations, from very small grassroots to huge. It includes our hospitals, it includes faith-based, and more importantly, it also includes those binational partners that maybe weren't at the table before. We are a county of 1, and we have lots of departments, over 17,000 employees. They bring lots of services. Their residents, we brought them to the table too, in terms of the different department and the resources. Absolutely amazing to have this framework to help, direct us and move us in the right direction. It's a journey, right? So be prepared for that journey, but it's an impactful journey. It's an eye-opening journey. It's an amazing journey. And the reason is the framework is really going to help work together with community to move forward what is important and near and dear to that community. Going between impactful and opportunities. I like both of those.